Welcome to our deep dive into a really interesting condition that we see in canine neurology. Um, Idiopathic generalized tremor syndrome, you might know it as IGTS. And as the name suggests, it's been a bit of a mystery, in terms of its underlying cause. But this research really kind of delves into the possibility of an immune-mediated origin, kind of like some neurological disorders that we see in humans.
Yeah, that's right. The term idiopathic really kind of points to that. The root cause has really eluded us for quite a while now. This research, though, I think really takes us a step closer to understanding this condition by looking at the presence of certain antibodies in dogs that have IGTS.
So before we get into the specifics of the research itself, let's just do a real quick recap for our listener of what we already knew about IGTS. I mean, we often see this in younger dogs, especially in smaller breeds, although it can occur in any breed.
Right. Absolutely. And the defining symptom, as the name suggests, is going to be tremors, often affecting the whole body. And these tremors can get worse when the dog is excited or stressed.
Now, along with the tremors, are there other neurological signs that might be present in dogs with IGPS?
Yeah, you can often see ataxia, which is that lack of coordination, along with vestibular signs, things that deal with their balance and spatial orientation. And in some cases, we even see hyperthermia, that elevated body temperature.
And how is IGTS typically diagnosed?
Traditionally, the diagnosis has been based on a combination of things. The dog's signalment, meaning their breed, their age, their sex, the clinical signs that they present with, and then ruling out any other possible causes. MRIs often come back normal, but sometimes we can see abnormalities in the cerebrospinal fluid or the CSF.
So it's a diagnosis of exclusion in many cases. Now, what about the treatment? What are the treatment approaches?
Well, corticosteroids have been the mainstay of treatment, and they are often pretty effective at managing the symptoms. However, we can see relapses occur, and that's one of the challenges with this condition.
Which brings us to, I think, the real crux of this research, exploring this potential immune-mediated cause for IGTS. By focusing on specific antibodies, can you maybe elaborate on that a little bit for our listener?
Sure. So this study looked at 33 dogs that had a diagnosis of IGTS, and they analyzed blood and CSF samples from these dogs. And they were looking for antibodies that have been associated with similar neurological conditions in humans.
And these antibodies target very specific components of the nervous system, right? Can you tell our listener a little bit about those targets?
Yeah, so they were looking specifically for antibodies against targets like LGl1 and GFP, among others. And these are proteins that are found in the nervous system. And if there are antibodies against those proteins, it could suggest that there's some kind of autoimmune process that's happening.
And this is where it gets really interesting, I think, for me at least. The study did find a small number of dogs that tested positive for these antibodies.
Right. Yeah, that's right. And the most common antibody that was found was actually the LGl1. Now, even though it was found in a small number of dogs, the presence of these antibodies is still a significant finding, because it kind of hints at that possible link between autoimmunity and IGTS.
And why is that link so significant? What does that mean for how we understand this condition?
Well, if we can confirm that IGTS is an autoimmune disorder in at least some dogs, it could really revolutionize how we diagnose and treat the condition.
So we're talking about potentially developing treatments that are much more targeted.
Right.
Therapies that specifically address the immune system's role in this disorder.
Exactly. This research opens up a whole new way to look for treatments that could be more effective and have less side effects than our current options.
Okay, so we've set the stage here with, the background on IGTS and this exciting potential of this research. Let's dig into the specifics of the study itself. What kind of details did the researchers collect on the dogs in this study?
They looked at a range of factors, including, the breeds of dogs that were included, their median age and weight, the specific symptoms that they displayed, whether there were any abnormalities in their CSF, and then, of course, the outcome of the treatment they received.
And I'm curious about those outcomes. Were these dogs able to recover from this condition?
The good news is none of the dogs in this study had what was considered a poor outcome, meaning none of them died or were euthanized because of the IGTS. However, 7 of the 33 dogs were actually lost to follow-up, so we don't know their long-term outcome.
So that's an important little caveat there. What about the dogs that they did have follow-up information on? How do they do?
Well, of the dogs that we know the outcome for, 55% of them had what we call a good outcome, which means they didn't have any relapses after treatment. The remaining 24% of the dogs that we knew the outcome for had what was considered an acceptable outcome. This means that they did have 1 or more relapses. but they responded well to changes in their medications that were being used to suppress their immune system.
That's encouraging. So more than half the dogs with a known outcome made a full recovery. And those that relapsed were still able to manage their condition. Did the researchers find any connection between those autoantibodies and the outcomes?
That's a really great question. Unfortunately, the study wasn't really big enough to draw any firm conclusions about that. There were some interesting trends, though. The dogs with detectable antibodies, they were actually more likely to have hyperthermia and those abnormalities in their CSF, which might point to a more severe form of IGTS in those cases.
So even though we can't definitively say those autoantibodies are directly causing the disease, there seems to be some correlation there. And it makes sense that if a dog has more involvement of the immune system, they might have more severe symptoms. Now, what about those relapses? Were there any factors that seem to predispose those dogs to having relapses?
Yeah, interestingly, they found that the dogs that received cyclosporin and the ones that had positive titers for distemper virus antibodies were more likely to have relapses. But again, this is a small study, and more research is really needed to confirm these findings. Correlation doesn't always equal causation. There could be other things at play here.
They also found a positive correlation between the age at which the dog presented and how long the clinical signs have been going on before they presented to the veterinarian, as well as the protein concentration in the CSF. So older dogs basically tended to have a longer period of symptoms before they were diagnosed, and they also had higher levels of protein in their CSF. That's interesting.
Yeah, and there was also a positive correlation between the dose of prednisolone they were given and the white blood cell count in their CSF, suggesting that the higher doses were used in the dogs that had more inflammation. And they also found a correlation between the IgA concentration in the blood and the IgA concentration in the CSF, which might indicate there's kind of a systemic inflammatory component to IGTS.
It's a lot of interesting kind of connections there. But we do need more research to really tease out, what are the causes and what are the effects? What would you say are some of the key limitations of this study?
Well, the biggest limitations, I think, are that it was a retrospective study with a pretty small sample size. Also, none of the dogs had a histopathologic confirmation of their IGTS diagnosis. So we can't absolutely rule out other causes of tremors.
And, they were using tests that were designed for humans to detect antibodies in dogs. It's possible that tests that were specifically made for dogs would be even more sensitive, and we'd find even more cases of antibody-mediated IGTS in dogs. So despite these limitations, though, this research, I think, opens up some really exciting doors for how we might diagnose and treat IGTS in the future. It suggests that IGTS might be an autoimmune disorder in at least some dogs, and that identifying those specific antibodies could lead to earlier diagnosis, more targeted treatment, and maybe even preventing those relapses from happening. This is definitely an area to watch in the coming years. So we've covered a lot of ground here today. What's the main takeaway for our listeners?
I think the biggest takeaway is that this research gives us a whole new way to think about IGTS. It's no longer just this mysterious condition with no known cause. We're finally starting to figure out how the immune system might be playing a role in IGTS. And I think that's really exciting. This research raises some big questions. What does this mean for how we diagnose and treat IGTS in the future? What are the implications for breeding practices? And how can we best support the dogs that have IGTS and their families?
Those are all questions that researchers are looking at right now. And we will keep our listeners updated on any new findings in this exciting area of vet neurology.
Absolutely.
I think that's a great place to pause. We've gone over a lot of information today, and I'm sure our listeners will want to hear more about this in the next section.
They will. So picking up where we left off, let's talk a little bit about the treatment aspect of this. You mentioned that corticosteroids are kind of the typical go-to for IGTS cases. Was that the case in this study as well?
Yeah, all the dogs in the study actually received some form of medication that modifies their immune system. And the vast majority of them, 33 of them, were actually treated with prednisolone.
Interesting. And did they all receive the same dose of prednisolone?
Not exactly. The starting doses actually varied a bit. 2 dogs were started on 4 milligrams per kilogram per day. 23 of them were started on 2 milligrams per kilogram per day. And that 8 of the dogs received 1 milligram per kilogram per day.
Okay, so a little bit of variation there in how they approach the treatment. What about other immunosuppressive medications? Did any of the dogs receive any of those?
Yeah, a few of the dogs did receive additional immunosuppressive drugs. 4 dogs were given cyclosporin, 2 received cytosine irabinoside, and then 1 dog was treated with mycophenolate Mofetil.
And did the researchers make note of any side effects from that prednisolone?
Yeah, they did. About 48% of the dogs actually experienced some side effects. with lethargy, polyuria, polydipsia, and polyphagia being the most common.
So some potential side effects there to keep in mind, but thankfully they seem to be mostly manageable.
Right. And in some cases, those side effects might be a worthwhile trade-off for controlling those tremors. I'm curious about the long-term outcomes for these dogs. Did they all recover?
The good news is that none of the dogs had what we would consider a poor outcome, meaning none of them died or were euthanized because of their IGTS. However, 7 out of the 33 were lost to follow-up, so unfortunately we don't know their long-term outcome.
That's an important caveat. So what about the dogs that they did have that follow-up information for? How did they fare?
Of the dogs that we know the outcome for, 55% of them had what's considered a good outcome, meaning no relapses after their treatment. And then the remaining 24% of the dogs that we know the outcome for had what was considered an acceptable outcome, meaning they had 1 or more relapses. But they responded well when we adjusted the medications they were on to suppress their immune system.
That's encouraging. So more than half the dogs with a known outcome made a full recovery. And those that relapsed were still able to manage their condition with some medication adjustments. Did the researchers find any link between the presence of those autoantibodies and the outcome?
You know, that is the million-dollar question. Unfortunately, this study just wasn't large enough to really make any definitive conclusions about that. They did note some interesting trends, though. So dogs with detectable neural autoantibodies, they were more likely to have hyperthermia and also to have those abnormalities in their CSF, which suggests that maybe it's a more severe form of IGTS in those dogs.
So even though we can't definitively say those autoantibodies are directly causing the disease, there does seem to be at least some correlation there. And it makes sense, I guess. If a dog has more involvement of their immune system, they may have more severe symptoms. What about those relapses? Were there any factors that seemed to predispose the dogs to having relapses?
Interestingly, they found that dogs that received cyclosporin and those that had positive titers for distemper virus antibodies were more likely to have relapses. But it is important to note that this was a relatively small study, and we really need more research to confirm these findings. Correlation doesn't always equal causation. There could be other factors at play.
Yeah, they also found a positive correlation between the age at which the dog first showed signs and the duration of those signs before they were actually seen by the veterinarians, as well as the protein concentration in their CSF. So basically what that means is older dogs tended to have symptoms for a longer period of time before they were diagnosed, and they also tended to have higher protein levels in their CSF. So that's an interesting finding.
Right. And there's also a positive correlation between the dose of prednisolone that they received and the white blood cell count in the CSF, suggesting that the higher doses were probably being used in dogs that had more inflammation. And they also found a correlation between the concentration of IgA in their serum and the concentration of IgA in the CSF, which could mean there's a systemic inflammatory component to this whole thing.
So lots of interesting connections there. But again, as you said, more research is needed to frame and tease out, what's the cause and what's the effect here. What would you say are some of the key limitations of this study?
I think the biggest limitations are that it was a retrospective study, and it had a fairly small sample size. Also, none of the dogs had a histopathologic confirmation of their IGTS diagnosis, so other causes of tremor can't be completely ruled out.
And of course, they were using tests that were designed to detect antibodies in humans to detect the antibodies in the dogs. So it's possible that if we had a test that was specifically designed for dogs, it would be more sensitive, and we would find even more cases of this antibody-mediated IGTS in dogs. So despite these limitations, though, I think this research opens up a lot of really exciting possibilities for how we might diagnose and treat IGTS in the future. It suggests that IGTS might be an autoimmune disorder, at least in some dogs, and that if we can identify these specific antibodies, it could lead to earlier diagnosis and more targeted treatment, and maybe even prevent those relapses from happening in the first place. This is definitely an area to watch in the coming years. So we've covered a lot of ground here today. What would you say is the main takeaway for our listeners?
I think the biggest takeaway is that this research really gives us a whole new way of thinking about IGTS. It's not just this mysterious condition with an unknown cause anymore. We're really starting to understand how the immune system might be playing a role in this condition. And I think that's incredibly exciting. And, this research raises some really important questions, like what does this mean for how we're going to diagnose and treat IGTS in the future? What are the implications for breeding practices? And how can we best support those dogs that have IGTS in their families?
And those are all really important questions that researchers are actively investigating right now. And we will, of course, continue to keep our listeners updated on any new developments in this really exciting area of veterinary neurology. Welcome back to our deep dive on idiopathic generalized tremor syndrome in dogs, or as you might know it, IGTS. We've been really kind of digging deep into this groundbreaking research that suggests a connection between this, somewhat mysterious condition and the immune system.
Yeah, this research really does challenge the idiopathic label that we've given IGTS for so long. Finding these specific antibodies in some of these dogs really opens up a whole new world of possibilities for, understanding how to diagnose it, how to treat it, all that good stuff.
Yeah, it really does feel like we're finally getting a glimpse behind the curtain there, seeing what role that immune system might be playing, in triggering these tremors.
Exactly. And that's what makes this research so exciting. We have a new direction to explore now. We can think about developing therapies that are much more effective and hopefully have fewer side effects than the treatments that we have right now.
So let's dive into some of the finer points of this study for our listeners. This research was conducted across 4 different veterinary institutions.
Correct.
That's right. It involved a teaching hospital in Germany, a teaching hospital in the United Kingdom, a private practice in Germany, and a private practice in the UK. And they looked at records from 2015 to 2022, so it's a pretty comprehensive data set. Besides those core findings about the antibodies, did anything else sort of interesting pop out at you from this study?
One thing that was kind of interesting was that there wasn't a statistically significant relationship between the outcome and the dog's age or sex or weight, or even the duration of the clinical signs before the dog was presented to the veterinarian.
So those factors don't seem to play a big role in how well a dog responds to treatment.
It seems that way. They did find, though, that dogs that received cyclosporin, that immunosuppressive drug, they were more likely to have relapses.
So is cyclosporin maybe just not as effective as other treatments for managing this long term?
That's a good question. Or maybe it needs to be used in combination with something else to prevent those relapses. Definitely something that needs more research.
Yeah, for sure. Now, we know that corticosteroids are often used to treat IGTS, and they're generally pretty effective. Did this study look at the use of corticosteroids at all?
Yeah, they did. In fact, all of the dogs in the study were treated with some type of medication that affects the immune system, and the vast majority of them got prednisolone, which is a corticosteroid.
And did they find any connection between the dose of prednisolone and the outcome?
Well, there wasn't a direct correlation between the initial dose and how the dog did overall, but they did see that the dogs that got higher doses of prednisolone tended to have higher numbers of white blood cells in their CSF.
So maybe the dose needs to be adjusted for each individual dog, depending on how severe their inflammation is.
Right. That personalized approach to medicine, which we're seeing more and more of.
Exactly. Now, you mentioned that some of the dogs did experience relapses. How common were those relapses?
Of the dogs that we know, the outcome for about 11.5% relapsed at least once, 7.7% relapsed twice, and another 11.5% had more than 2 relapses.
So relapses are a real concern with this condition, and we really need to find some better treatments to prevent them from happening in the first place. This research is really interesting, but it feels like we're just scratching the surface here.
I think that's a good way to put it. This study has shown us that the immune system might be playing a role in IGTS, but there's still so much we don't know.
What are some of the questions that we still need to answer?
Well, we need larger studies,
Yeah.
to really confirm these findings and to get a better idea of how common these antibodies are in dogs with IGTS. We need to develop tests that are specific for dogs
Yeah.
and more sensitive and accurate, too. And we need to figure out what role other immune cells are playing, like T cells, for example.
So we've got a pretty good roadmap for future research then. Hopefully those studies will give us a much clearer picture of what's going on with this complex condition. What's the one thing you want listeners to take away from our conversation today?
I think the biggest thing is that this research offers hope. We're getting closer to really understanding IGTS, and hopefully that will lead to better treatments that can improve the quality of life for these dogs.
And that's a message worth sharing. This has been a really fascinating deep dive into canine neurology. And as always, from Vet Neurojar, keep those minds inspired, hearts light, and tails wagging.